Today we're speaking about incontinence, and it remains one of the most under-discussed health concerns that exist, despite its significant impact on quality of life. This is obviously because of the stigmatization, but also of the deep shame and embarrassment that could occur through this condition. It's characterized by the involuntary loss of bladder or bowel control, and this condition affects individuals across various age groups and can lead to physical discomfort, emotional stress, and social withdrawal. We're helping to understand a little bit more about incontinence in this hour of the show. Joining us on the line is Dr. Dakalo Muavha, who is a urogynaecologist. Thank you so much, Dr. Muavha, for your time this morning.
Thank you so much for the opportunity. I was told it's going to be a Zoom. I've already went to buy a new suit so that I can look nice for you, Palesa. But I think technology didn't work for us.
Yeah, no, technology isn't that great all the time, but we're still glad to have your voice here, because what's most important is the information that we'll be getting from you this morning. Let's speak about this. I know there'll be a lot of people who are even hearing this term for the first time, incontinence. I know I gave it a brief introduction, but please explain to us what this term means.
Thank you, Palesa. So let me give you a typical example. You have a 46-year-old female teacher who delivered 3 years ago, and now in the process of being boarded out of her work, because every time she's teaching maths, every time she's teaching, she has to go to the toilet every 30 minutes. So she can't finish that lecture. She comes back from the toilet and found that her trouser or her clothes are wet of urine, and she's smelling of urine. Ultimately, what does she do? She decides not to go to work anymore. The principals say, we can't have this where you are not coming all the time. She end up being boarded and not go to work and be fired at work. Now staying at home depressed, and some of them actually end up committing suicide. I wanted you to give you a picture of that teacher who is unable to control her urine. Before she gets to the toilet, urine just leaks. When she sneezes and coughs, urine comes out. Or at times, even when she's just sitting, urine just comes out. So urinary incontinence is when someone is unable to control a bladder, and that person wets themselves. And it has a significant quality of life impact. For this particular patient, as an example, she's unable to go to work because of that. Some people have divorce, okay, because they get humiliated or feel embarrassed to be intimate. Elderly women, sometimes when they rush to the toilet and urine leaks, they can fall. If a 60, 75-year-old patient falls and have a hip fracture, it means that they need to be bedridden. Sometimes that can also result in death. So this urinary incontinence is a complex problem with a significant real impact of people's lives. And the unfortunate part is that these patients actually suffer in silence. So for us to be discussing about it today, I'm very excited, because we will be able to get solution for patients.
Sure, that is, quite a lot. And the information is, I love the fact that you started with an example, because you have humanized this condition and helping us understand the impact that this has on the individuals who suffer from incontinence. But you've used a lot of women as examples. Is this a condition that impacts women more than does men, or is it just as a subject by subject? It's not really something that is gender specific.
Good question. So, Palesa, if you have in your studio right there, if there are 3 women where you are, one of you has this kind of problem or has experienced this kind of a problem in their lifetime. So it's so common, 1 in 3 women would be having this. Some of them would make it as a joke and say, whatever, when I sneeze and cough, urine comes out, and they laugh about it.
Yeah.
But but in real sense, when urine leaks and you wet your pants and you smell of urine, consciously you're going to think about it. No matter how best you are in your work, but if you're feeling that you're smelling of urine, it will impact even how you deliver in your work. So it's very common, Palesa. It's 1 in 3 women. It's more common in women than in men.
Okay, I see. Well, let's go deeper into this condition. If it is more common in women than men, and it sounds really common because 1 in 3 is actually quite a close statistic. That means many women are suffering from this. What causes this incontinence?
Yes, thank you, Palesa. In women, the biggest cause is something which they don't have, most of the times, they don't have control of. Is the fact that they are women. The fact that you're a woman, you're already at high risk of having urinary incontinence. Okay. The second thing is childbirth. Okay, just being pregnant, whether you delivered or not, just being pregnant alone because of the heaviness of pregnancy and also the hormonal changes which you call progesterone, they affect the strength of the pelvic floor, which are muscles which are assisting you to control urine. Also giving birth. If you go and give birth normally, or sometimes the baby is big, or they have to use some bit of instruments to take the baby out, or they will have to do an episiotomy, what many women call it a stitch, when they've cut that stitch. All those things poses you as a woman at risk to have this problem. But even women who has chronic conditions such as chronic cough, like patients with asthma, who suffer from asthma and they cough quite often, that weakens the muscles in the pelvic floor, and that makes you to be at risk of urinary incontinence. Obese women, people with a little bit of weight, also put a lot of strain on this pelvic muscle, and it makes them to be to have weakness in the pelvic floor. The other things is medical conditions. There are people with stroke, people with Parkinson's disease, and some neurological condition can affect the control of your bladder. Something which normally happened but go away, it doesn't stay long, is when you have a urinary tract infection. Just infection in your bladder could result in you not be able to control your urine. But other things could be also when you have a cancer, cervical cancer can spread into the bladder and cause a hole, and that can result in you not be able to control your urine.
All right. Sounds like there's a variety of reasons that could cause incontinence. Let's find out a little bit more about this particular condition after the break. Stay on the line with us, Dr. Muavha. We're going to continue understanding and unpacking incontinence with you after this break.
Este é o Caleidoscópio de Canal África, com Moreno Samo e João Yabalá.
O surto da cólera em Angola tem causado grande preocupação, afetando já mais de metade das províncias do país. Simultaneamente, a Agência dos Estados Unidos para o Desenvolvimento Internacional, USAID, um dos maiores doadores mundiais de assistência humanitária, decidiu não priorizar os países com maior incidência de malária. Para discutirmos as causas do alastramento da cólera em Angola e os impactos dessa decisão da USAID, convidamos o Dr. Jeremias Agostinho, médico e mestre em saúde pública, para partilhar a sua visão sobre o tema.
A doença, nesse momento, representa o maior risco de saúde pública que nós temos. Nos últimos anos, a nossa preocupação esteve sempre centrado com os casos de malária, os casos de tuberculose e também de infecção por VIH-Sida. A forma como, em pouco menos de 2 meses, os casos de cólera vêm aumentando, acaba por representar, nessa altura, um dos maiores desafios que o país tem. É expectável que, nesta fase, o número de casos venha a aumentar.
De segunda a sexta-feira, das 20 às 21 horas locais, este é o Caleidoscópio de Canal África.
All right, it's 11:23 Central African time. You are listening to On the Move, and today we're speaking about what is called incontinence, which is something that is underreported. This is involuntary loss of bladder or bowel control. We're speaking to Dr. Dakalo, who's joining us on this one today. Doctor, you've highlighted so many interesting things. And, you know, some people, like you highlighted earlier on, could be taking it lightly, having this involuntary loss of bladder or bowel control. but at times it can be something that is shameful and it's difficult to see it as a health condition. Maybe people think maybe they themselves are not in control of their bladder and their bowel system. How do you know that this is something that, is out of your own control?
Excellent question. Yeah. So most of the times the symptoms can start from it happens only when I'm doing bungee jumping in the gym once in a month, it just happened with some bit of occasion, but not all the time. But it could go to a point where someone is wearing nappies. So to know if this is a problem for you is when it starts affecting your lifestyle. When you now want to go and buy something in the shop and you're thinking twice about going to buy, or you sending the sick note to your boss without no reason because you are worried that you don't want to be exposed that you're having urinary incontinence. So no matter how much urine leaks, it's not about, okay, it's a cup leaking, it's a half a cup, it's as long as it affects your day-to-day life. If you are a little bit shy to be intimate with your partner, no matter how little it is, because some people, they will have a leaking of urine when they have sexual intercourse, and that will just destroy the mood. So the bottom line is, it's not how much it leaks, it's how much it affects you as an individual. As long as it starts affecting you as an individual, you have to go and seek help.
So interesting, because we connect that part of our lives as private, right? So even going to a doctor, it's difficult for us to do. Have you encountered patients who struggle with incontinence, and how has the environment been when they come to you? I'm sure it's difficult for them.
Yeah, I'll give a classical example. This I'm so proud of it, and that happens afterwards. It's a patient who has been suffering from this kind of a problem for almost 6-7 years. Wow. Coming from my village, and I don't practice in my village, I practice in Petersburg Hospital, coming from Kangwashinyamani village. Okay. This mother has been not going out and not doing any activities at home, or it's like a grandmother was not able to interact and do with the community. Mm-hmm. She came and had treatment with us. And when she went back home, she was just discussing. No one knew that she had this kind of problem. Now she was playing soccer, which we call bakegula with other grandmothers.
Love those.
And then she was just in passing talking about, I was seen by Dr. Muavha who helped me with this kind of problem. Now I'm actually playing soccer. So, but for 6 years, all the community didn't know about it. But once she got help, she was able to tell everyone that she got help. What I'm trying to say is that majority of the patients, they spend at least 3 years before they tell anyone, let alone the doctor. So majority of them would stay with it without talking to anyone. But the more we talk about it, the more we have good example like this mother who had help. Many people now come forward.
Okay.
So at most, people do not come forward because they feel ashamed. When you are there in the studio, you can easily say, I have headache, and people will sympathize with you. Yeah. You can say, I've got back pain, and sympathize with you. But you can't say, I have problem with urinary problems. Yeah.
Because even to say it, even when you say it, it just sounds like, you are doing it voluntary. It's not something that it's something that you can actually control. You spoke about remedies. Before we wrap up, let's talk a little bit about the remedies. We only have 2 minutes left. What's the way to deal with incontinence?
Yeah, so there's something which you at home can do already. One is if it's issues related to your weight, you can do exercise and reduce your weight. This urinary incontinence can sometimes be worsened by type of food, like drinks, like coffee, alcohol, spicy food. So anything which is triggering that problem, you can actually reduce that. Some people, they drink a lot of water because they want to lose weight. You're drinking 5 liters in a day. That could be excess and can cause with urinary issues. So you need to drink enough water, but not too much excess. So if that didn't work, and the last thing is that you can do Kegel exercise, which is the exercising of the muscle of the pelvic floor. That can actually improve. If that fails, please come to the go to the nearest doctors, and do not take the answer when a doctor are "Ke o hola, e ko kula." Mama is part of growing up. That is not correct.
Okay.
And most of the doctors will say that because they may not have an experience in dealing with such patients. So insist on being referred to the doctor who's going to be able to assist you. There are medication which we can give you for you to get better, even not operation, just medication to be able to address. So if medication doesn't work, there are some small procedures which we perform to make you feel better.
Okay, Dr. Dakalo, you are fantastic. Very easy to understand. Thank you so much for helping us on this one. And thank you for joining us here on Channel Africa.
Absolutely. Thank you. I really appreciate for the invite. Thank you so much.
That's Dr. Dakalo Muavha, who is a urogynaecologist, helping us on incontinence in our Live Well. Have you experienced this? Give us your thoughts on our WhatsApp and also our social media. It's 11:30 Central African Time.